Apis mellifica, a homeopathic remedy derived from honeybee venom, is a powerful medicine used to treat a wide range of conditions characterized by stinging, burning pain, redness, swelling, and extreme sensitivity. Its action mimics the symptoms of a bee sting, making it particularly effective for inflammatory conditions, edema, and disorders affecting the skin, urinary system, and serous membranes. General characteristics: main action: Apis targets cellular tissues, especially those of the skin, mucous membranes, and serous membranes. Key symptoms: rapidly developing edema, sensitivity, stinging or burning pain, shiny redness, and significant swelling resembling hives or erysipelas. Mental sphere: patients may alternate between extreme restlessness and despondency, reflecting nervous irritability and emotional instability. Mental symptoms: emotional instability, fluctuations between irritability, fidgetiness, and melancholy. A tendency to weep without cause, feeling dissatisfied and discontented. Behavioral traits: aversion to being alone, constantly seeking company but remaining restless and hard to please. Awkwardness, frequently dropping objects due to nervousness or absent-mindedness. Specific mental states: jealousy, often prominent in widows or those experiencing grief. Despair, with fears of being poisoned or premonitions of death. Physical symptoms: head, intense burning or stabbing headaches, especially in the back of the head or extending to the eyes, worsened by heat and lying down but relieved in open air. Symptoms resembling meningitis, including shrieking cries, sensitivity to touch, and burying the head in the pillow. Hydrocephalus, with an inability to hold the head upright. Eyes puffy and swollen eyelids with redness, burning, and watery discharge. Inflamed conjunctiva appearing shiny and described as looking like raw meat. Sensitivity to light and blurry vision. Throat: swollen and tight throat with burning, stinging pain, worsened by heat and improved by cold drinks. Edematous, red and inflamed uvula and tonsils. Difficulty swallowing solids due to a sensation of constriction. Urinary system: scanty, high-colored or cloudy urine, often with burning or stinging pain. Retention of urine, especially in infants or postpartum women. Symptoms of nephritis, including albuminuria and general edema. Skin: rosy, shiny, and highly sensitive skin with eruptions resembling hives or erysipelas. Stinging, burning, and pricking sensations, often with intense itching. Edema, particularly under the eyes or as generalized swelling, worsened by warmth and relieved by cold applications. Female reproductive system: right-sided ovarian pain and swelling, often linked to suppressed menses or hormonal imbalances. Irregular menstruation, postpartum irritability, and emotional disturbances. Respiratory system: symptoms of pleurisy with sharp stabbing pains and difficulty breathing. Asthma attacks triggered by hives or allergic reactions, often with a tight chest. Digestive system: burning sensations in the abdomen with a bruised feeling on palpation. Diarrhea with watery, greenish or slimy stools, often painless but involuntary. Constipation with a sensation of tightness in the abdomen. Modalities, or the factors that worsen or improve symptoms, play a crucial role in understanding Apis. Symptoms are worsened by heat, such as warm rooms, hot baths, and sunlight. Lying down, especially on the right side, can also aggravate symptoms, as can suppressed eruptions or discharges and emotional shocks like grief, anger, or jealousy. On the other hand, symptoms are improved by cold applications and cool air, open spaces, sitting upright and uncovering or removing clothing. Now let's dive into the clinical applications of Apis. This remedy is highly effective for a variety of conditions. For edema, whether generalized or localized, Apis is often indicated when the skin appears shiny, red, or waxy. It's also beneficial for inflammatory conditions, including tonsillitis, meningitis, peritonitis, and pleurisy. When it comes to skin disorders, Apis can be used for hives, erysipelas, burns, and stings. In the realm of urinary issues, it addresses cystitis, nephritis, and urinary retention. For reproductive disorders, Apis is useful for ovarian cysts, menstrual irregularities, and postpartum conditions. It also helps with allergic reactions, particularly angioneurotic edema and anaphylactic tendencies. Lastly, Apis is valuable for other conditions such as typhoid and malarial fevers, especially when there is stupor, delirium, and thirstlessness during the heat stage, as well as hydrocephalus and meningitis with severe mental and physical symptoms. When it comes to dosage and potency, Apis can be administered in various potencies, including 6x, 30C, 200C, and occasionally higher. The repetition of doses should be frequent in acute conditions, while less frequent dosing is recommended for chronic cases. Alright, so let's talk about some important precautions. First, it's crucial to avoid using this remedy immediately before or after roost tox, as there's an incompatibility between the two. Also, be sure to monitor for any aggravations, especially if you're using high potencies in sensitive individuals. This is really important to ensure safe and effective treatment. Differential diagnosis, distinguishing Apis from similar remedies. The document provides a detailed comparison of Apis with other remedies that share some similar symptoms. The key differences are summarized below. Apis versus belladonna. Both have redness, heat and swelling, but Apis has more pronounced edema, burning, stinging pains, thirstlessness and jealousy. Belladonna has vivid redness, throbbing pain and may present with delirium or violence. Apis versus Rhus toxicodendron. Both are used for skin conditions and restlessness. Apis has shiny, edematous skin, better with cold, burning, stinging pain and migrating symptoms. Rhus tox has vesicular eruptions, itching relieved by warmth, joint stiffness improved by movement, and aggravation in damp cold. Apis versus Arsenicum album. Both have restlessness, burning and weakness. Apis has burning with stinging, swelling and thirstlessness. Arsenicum has intense burning, relieved by warmth, anxiety, fear and thirst for small sips. Apis versus Cantharis. Both are used for urinary issues with burning, stinging. Apis has less intense burning, systemic edema and thirstlessness. Cantharis has extreme burning pain and frequent agonizing urges to urinate. Apis versus Natrum muriaticum. Both have swelling under the eyes and edema. Apis has shiny, swelling better with cold and jealousy. Natrum mur has dull swelling related to grief and emotional withdrawal. Apis versus Pulsatilla. Both address hormonal imbalances, menstrual irregularities and tearfulness. Apis has prominent swelling, stinging, burning and jealousy. Pulsatilla has shifting symptoms, seeks consolation, and is better in cool air. Apis versus Lachesis. Both have right-sided complaints, sensitivity to touch and constriction. Apis has burning, stinging, shiny edema and thirstlessness. Lachesis has throbbing pain, bluish discoloration and aggravation from pressure. Apis versus sulfur. Both are used for skin conditions with burning or itching. Apis has burning with stinging, avoids warmth and has rapid onset. Sulfur has burning/itching worsened by heat and bathing, dry scaly skin and a philosophical disposition. In conclusion, Apis mellifica is a valuable homeopathic remedy derived from honeybee venom, effectively addressing a constellation of symptoms characterized by stinging, burning pains, edema, redness, and sensitivity. Its action mirrors the effects of a bee sting, making it particularly suited for inflammatory conditions, skin disorders, urinary complaints, and certain female reproductive issues. Keynotes for Apis include rapid onset of swelling, a shiny or waxy appearance of affected areas, thirstlessness, and a mental state marked by restlessness, irritability, and sometimes jealousy. Understanding the modalities, worsening from heat and improvement from cold, is crucial for its proper application. While Apis shares some similarities with other remedies like belladonna, Rhus tox, Arsenicum album, and others, careful differentiation based on the specific symptom picture, including mental and emotional aspects, is essential for accurate prescription. This comprehensive overview provides a clear understanding of Apis mellifica for both practitioners and those interested in homeopathic principles, emphasizing its unique therapeutic potential within the broader context of homeopathic medicine. Disclaimer: this information is provided for professional homeopathic practitioners only. The author assumes no responsibility or liability for any misuse or improper application of the remedy. This remedy should only be used under the supervision of a qualified homeopathic practitioner. That's all for today. Do you know that homeopathy claims itself as holistic medicine? Do you agree? Feel free to share in the comments below. If you'd like to learn about new remedies, let me know in the comments, and I'll do my best to cover them as soon as possible.